cities.
Thank you so much. Already off to a fantastic program, and so important that we're putting that focus on the intersection of climate and health. And Patty, wonderful for you to be here, and let's dive right in because we got to make the most of this time we have. So let's talk about what do we need to think about in terms of cities sitting at this intersection. I think we kind of instinctively know that climate, air quality, big issue for cities, but how are you thinking about this?
Yeah, I think cities are at the coalface, really, of the climate crisis. And we know from what Vanessa said that climate crisis is a health crisis. It's a water crisis as well. But the proximity to cities, you really feel whether it's increasing temperatures, whether it's poor air quality, whether it's NCDs or communicable diseases that are on the increase. Cities are really at the forefront of the climate crisis. And as we think about how the world is changing and where people are living, you know, 50% of us today live in cities, but by 2050, that number goes up to 75%. And we know that the cities, as they're constructed today, are not really equipped for this kind of exponential growth. So if I just talk a little bit about a city, for instance, of Barcelona. Lots of people have been to Barcelona, fantastic city. But 60% of the public space in Barcelona is actually targeting cars and concrete. So as we think about more and more of us living in cities, we have to think about how cities need to evolve and change such that they can accommodate us in living. So that means in the case of Barcelona, 160 hectares will be dedicated to green spaces. It means 10 biodiversity shelters. So this is an important thing. So actually, when we're thinking about cities and climate and health, we're actually talking to different stakeholders than we used to. So urban planners as an important constituent for health.
Right. And to think Joni Mitchell wrote that song all those years ago, warning us about the parking lots. So bring in the health component of it. So I think that anyone who's lived in a city and has been through administrations that are trying to greenify, we're sitting in New York, we know there was a big effort. If you've been to the West Side, the High Line we understand trying to address air quality. What's the impact on health, and where do we need to think about changes in the health system? How can thinking about healthcare systems mitigate some of what we see that's going on? Where do they fit in the puzzle?
Yeah. Most of the climate discussions like at UNGA this week happen at a multilateral or a national level. So there are organizations of cities, C40 cities, climate resilient cities, et cetera, but they're not really thinking in terms of the nexus of climate and health. And so
that 40,000 foot.
Yes.
Conversation.
Yeah. And I think what we're advocating for is really kind of a bottom-up approach in addition to that top-down approach, because cities and city mayors have a unique perspective in the fact that they don't think in those silos. And I think Vanessa, if I just pick up on Vanessa's point, which is we need to think horizontally in addition to those verticals. And city mayors, they think about education, they think about budget, they think about finance, they think about all of the different aspects of a city, and they have a unique perspective in terms of they've got the remit and they're innovating. Our cities are really innovating and leading the way. So I think we need to make sure that we're supporting our cities and our city mayors, because these folks are elected.
Well, they're accountable. I was just going to say, especially when we're talking about health, you can talk about large scale health problems, but if you have neighborhoods, if you have underserved communities, you're seeing the impact in real time. I think we all probably have anecdotal stories of things that happen if the highway is put in a certain place and there's too much air traffic. Can the healthcare, so what can those local officials, and with the powered by the community, because we know that helps scale solutions, what can be done there to address it? It seems like that's what happens. That's where they end up afterwards in the healthcare system. Yeah. How do we need to change the way perhaps we're thinking about that?
I would say what we need to do is we need to rethink how we think about healthcare. Right now, if you are sick or feel unwell, you go to your doctor and you potentially have to go to the hospital, God forbid, and then you get better, and then you return to work. In this case, if we are reimagining and we're thinking about public health much more holistically, then your stakeholders are completely different. They're your educators, they're your pharmacists, they're your community healthcare workers, building healthcare resilience. We heard from Vanessa how important that is. But it's reimagining public health from a grassroots and what I call a place-based solution versus just a sick doctor situation.
Does that help solve how is that impacting climate? Does climate happen and then if we get to them earlier, we prevent worse outcomes? Or is it actually tied to climate in a more holistic way?
Well, we know, sadly, that 250,000 additional deaths will occur directly as a result of climate change, right? So we can talk about how we are going to decarbonize the healthcare system, the traditional healthcare system, and that needs to happen for sure. But the best way to decarbonize the healthcare system is to keep people well, right? So rather than treating a problem, if we focus on prevention and a community or what I call a place-based approach, then we can keep people healthier longer and therefore reduce carbon emissions and keep people healthier. This case of Barcelona, what I'm talking about, their plan, they're adding through the implementation by 2030, they're estimating that people in Barcelona will live over 200 days longer than they would have previously. So they're adding real adjusted life days and years onto people's health.
And less intervention. If you're getting it early, there's less intervention. What are some other examples of how people are addressing this, or how these programs are putting into place, and can it scale? I mean, Barcelona is a big place, so presumably that would be a good example. But what are you seeing that works for people who are out there who understand this problem, but who are perhaps looking for some examples to take back home to their local leaders?
Well, I think every city is going to have different challenges and different infrastructure and different support systems. And I think what you have to start with is, if you take we're working with the SMI, the Sustainable Markets Initiative, and we're looking at London right now. And ULEZ, for those of you who've been to London, is a tax, if you will, to bring your car into the city. And this has been hugely controversial in London in terms of reducing air quality. And you also see the taxis have gone down to 20 miles an hour in order to improve air quality. Because we know, when we look at cities, we know that air quality is a determinant of health, right? And reducing pollution in the air is going to make everybody healthier. But yet there's a significant pushback often from people who live in cities who want to be able to have that access and have that transport. But I think the most important thing for me is, as we think about healthcare, we need to think about what are the sources of what's making people ill. And air quality, for instance, is responsible, and poor air quality is responsible for 3 of the top 5 health indicators in a city like London. So if you're not combating air quality or improving air quality, you're going to be dealing with the consequences of poor air quality, and that's only going to put further stresses on your healthcare system. And finally, I think it's really important for us as a healthcare community to think about the social determinants of health. When you think about the social determinants of health, actually up to 50% of health outcomes are a direct result of social determinants of health. So while we're thinking about decarbonizing the healthcare system on the one hand, that's fine, well, and good. But if you're not addressing the social determinants of health, your access to proper nutrition, your access to affordable housing, your socioeconomic drivers, these are all incredibly important aspects. So to sum up, for me, cities give you that kind of umbrella way that you can look at all of those aspects and make sure that you're spending your time, your effort, your energy around the social determinants of health, decarbonizing the healthcare systems, and thinking about public health in a much more holistic way.
Just really quickly, public-private partnerships sounds like it's critical. It's critical across the SDGs and any conversation about sustainability, especially when we bring the finance part in. But it seems especially so here.
Yeah, I think if we redefine public health as public health, then you're talking to educators, you're talking to pharmacists, you're talking to council leaders, urban planners. Whereas if you just talk about climate and health, that kind of puts you over in another category that's just talking about the health commissioner or the Ministry of Health in a silo. And what we need to do is we need to think more differently about that.
Fantastic. Patty, thank you so much. Appreciate it. Thank you all.